And also, we do have now a charity foundation to help anybody who actually does need financial assistance having a challenge in the financial condition. We have started and we have done several cases already. So if you need to know, you can also look at the foundation website. It's www.bunionfoundation.org, and then you will find more information.
I was going to say also, I encourage you to check with your private insurance because in my case, most of it was covered. So be sure to double check.
Someone asked, when should I do the bunion surgery?
I've got an answer that.
Now?
Yes. Yes. Bunion, is not a critical problem that will affect one's health directly, but indirectly, yes, they will affect one's health because bunion is a condition that has been misunderstood for decades and by most third parties, because only the sufferers would know how difficult their feet become for just simple walking, daily walking, and that's because the biomechanics of the great toe, which is the most important part of the foot, will be affected. So when they walk, they have to compensate, walk in a different way, which is more strenuous and even cause secondary problems in other parts of the body. And so it's bunion is a function problem. So once the sufferer start to feel having problems walking because it's more strenuous, easier to get tired, and even start to feeling unstable, which means that when the big toe is not strong enough, not functioning properly, one may lose balance easily, and that's why many patients walk very slowly. Otherwise, they can lose balance. So to me, it's not just an X-ray or just the photo showing how bad the deformity is, because every situation is different, and so the patient would know how their bunion feet are affecting their daily life in terms of walking and doing whatever they want to do, and so usually it's the patient's decision.
Someone wants to ask you, when did you find that you're suffering from the bunion?
And I'm in my 50s now, so I probably started having that deformation start in my 20s. So it began fairly early because of the sports that I did, but the pain became unbearable in my early 40s, especially for that right. So for me, I wasn't as worried about the aesthetics, but it hurt all the time. So to get the surgery for me was I couldn't take the pain anymore. I couldn't wear shoes. So in my early 40s was when I got the right one done. The recovery was so painful because they broke it. I wasn't going to do it again. By the time I met Dr. Wu again, I couldn't wear closed-toed shoes. I was waking up in pain. So yeah, my bunions started quite early in life. The pain didn't really become a quality of life issue until I went and got the surgery. So my advice, just from a patient standpoint, is if you're in pain every day, you need to get it fixed. That's my personal opinion.
It's a condition that patients know the best whether they get help or practical.
即係當唔當佢係做完第一個手術之後，仲有冇花喎？
Oh, I see. Okay. So now I understand the question, which is that if after the bone breaking surgery and the recovery is not all that satisfactory and require further treatment, yes, depending how, because there are so many different ways to break the bone and to try to achieve the best results. Fortunately, in most cases, after failed bone breaking surgery, we still can help them by using the same technique, the syndesmosis procedure, and we have done so, and quite satisfactory. Yes, that's usually because the deformity has already occurred, because the ligament issue was not managed, so can still, yes, help them.
Can you share the worst case in your experience?
Okay. As a matter of fact, I had quite a few, and they are different. Okay. One was a lady about 81 years old, and people would say, Dr. Wu, how do they want to do such a surgery to such an old person? And my reason, not because I wanted to do, but the patient, first of all, very healthy, 80-year-old, and not taking any medication, wants to walk, and yet she could not because the bunion is so severe. She developed ulceration on the bottom of her foot, where usually people have the callus. That because she liked to walk so much, she walked until the skin broke, and so she wanted to have it corrected. We did, and the ulceration, as a matter of fact, healed after 2 or 3 months, and which recovered. Yes. And also we have many patients who tend to fall, and lose balance, and that's particularly kind of horrifying for older people. They could only walk slowly, but once because if they fall, they easily break their hips and that age. And I have even had I have done patients with paraplegia after stroke. The good side had to take over the work of the right side, and so the bunion developed so badly that they could hardly work, because one side is paralyzed, and the other one is having the severe bunion pain, unstable, and could not balance. And we did that, yes. And afterwards, we had another case where the patient had cerebral palsy since young, and also developed, and we could also help them.
So it seems it is no any age limit to do the bunion surgery.
Right. For this surgery, there is age limit. The limit is that younger patients whose bones, particularly foot bones, have not fully developed, then we have to wait until that has happened. For girls, their bones in their feet would all finish growing by the age of 13, 14 years old. For boys, it would be about 17 to 18 years old. Then only after the bone have all matured before this surgery can be done.
Someone asked them during the 6 months after the surgery, can we walk further than 5,000 steps within?
Yes, probably during the 5th and the 6th months. Yeah, most people were allowed to walk 5,000, 6,000 steps a day. Yeah. Only in the 5th and 6th months. Yeah. The 4th month, the transition time from 3,000 average like I said, for the first 3 months to 5,000-6,000 at the end of the 4th month. So the 5th and 6th months, yes, can walk to 5, 6, or even 7.
And what can you remind the people who have a risk to suffer from the bunion? How can they find that they are the people who are easily get the bunion?
Okay. Now, of course, bunion, the problem, the underlying, the basic problem with the bunion, or the cause of the bunion, is the ligament issue. And the ligaments can be weak due to heredity. So that means if you have a family history of the bunion condition, then not necessarily you are likely will be you inherited the genes for the bunion or weak ligaments. But especially if you are female, okay, and on top of the heredity, there is the hormone issue, the estrogen, because the estrogen, one of its the property is to help with the ligaments be more flexible and elastic. That's okay. For that reason, and the ladies are more flexible than men because of that. But it's not really for that reason. Okay, for the issue, the ligament. It's for the delivering baby. When it comes to delivery, and the estrogen, women, pregnant women, can elevate it 6 times normal. To loosen what? The ligaments, particularly around the pelvic area, so that for delivering easily the passage can be extended, can be expanded, and for the baby to come out. And also for that reason that during the pregnancy, the estrogen can increase by 6 times, by 6 folds. And for ladies that already had some bunion, okay, condition, then they would notice, particularly, they would suddenly become worse. Yeah, and that's
exactly
for
right.
the exactly happened to you.
Yeah,
Okay.
my children were 3, 5 when I had my first.
Did you?
Yeah,
Yes.
yeah.
And so in other words, for ladies particularly, and you have family history, then probably you should be careful with the kind of footwear you wear. And however, the ligament issue, okay, one may be thinking already now, and want to ask me is that is there any way, if I know that I have family history, I'm female, and any way I can do to help strengthen, make the ligament stronger, so that the deformity can be stopped, because otherwise bunion is a progressive condition, and that's because ligaments we have no way to help strengthen, not like bone. One lady with the osteoporosis, or man can have it also. We have medicine for that to help strengthen the bone. And if you want to strengthen your muscles, fine, easy, do your exercises. But for ligaments, there's no medicine, no supplements, no exercise, no therapy to help strengthen them. So that's the nature of the problem. So it's progressive, since you cannot help strengthen the ligament. Since you still walk, except if you don't walk, okay, then it would continuously become worse and worse. Although it's not a fast process, it's very slow, but it's always becoming worse.
So it seems that we can't control the bunion.
Unfortunately, really there is no device that you can wear to protect the first metatarsal, which has competent ligament to support it from being stressed, being displaced from walking, running, or jumping. And if for someone has the bunion condition, I would not stop doing sports just so that can avoid deterioration of the condition, because sports exercises are even more important, for your well-being than trying to protect your feet, because that's it's unpredictable. If you just carry on your normal life, and when it becomes necessary, which you cannot control it anyway, then when it becomes necessary, then yes, you can consider surgical treatment.
And someone asked me, will recommend your friends if they suffer from bunion to do the surgery in the future?
Absolutely. Yes, I would definitely recommend it. I would recommend this one over the other one, because the other one is painful, the recovery is long, and like Dr. Wu said, you're not correcting necessarily the ligament issue as well, so that has additional risk, right, down the road. Luckily, I didn't have that problem. I think I was just fortunate, but I would absolutely, sooner the better. And I wish I would have done it sooner. I suffered many years before I finally got brave enough to do it again. So no regrets other than waiting.
Okay. I think, yes, we have exhausted all the questions, and I would like to thank everybody for participating in this talk, and particularly Pamela, who
My
come
pleasure.
along, yes, to give us your time.
And we also have another question on end. And
Okay, one
someone
more.
asked, for patients outside of Hong Kong who want to go to Hong Kong for the surgery, what advice will you give them?
Okay. Yes, we have done quite a few, overseas patients, of course, before the COVID pandemic, and basically the patient can come in to Hong Kong the day, even just the day before the surgery, for me to look at it and discuss the whole thing, and then 10 days later, after we check that the surgical wound, no problem, and everything's in order, then usually on the 10th post-op day, the patient would fly back home. And then, of course, they were followed up by email communication and phone calls also. And basically every month they had to take X-rays of the feet for me to review to see if there is any early loosening. Okay, thank you again.
Thank you.
Bye-bye. Oh, and by the way, if you want to know more about the bunion condition and treatment, like we did not discuss the conservative treatment for the bunion, please, we have YouTube, and it's called Bunion Talk. Okay, we have two videos. One is about what the bunion deformity is, and the other one is what treatment one can help in bunion pain, so on. Bye bye. Thank you.
Bye-bye.